Shoulder separations are quite different than shoulder dislocations. As we mentioned previously, a shoulder dislocation happens when the ball pops out of the socket of the shoulder joint. When a separated shoulder occurs, the joint on top of the shoulder, called the AC joint, is the one that is injured. The AC joint is the joint that is formed between the collarbone, called the clavicle, and the edge of the shoulder blade, called the acromion. Normally, a shoulder separation happens when an athlete falls directly on the outside edge of their shoulder. The acromion, or shoulder blade, is forced downward, causing the ligaments that stabilize the collarbone to the shoulder blade to be stretched or disrupted. There's two major sets of ligaments that stabilize the collarbone and shoulder blade together. These ligaments that run transversely like this are called the AC ligaments, and those are the ones that are injured in more mild shoulder separations. In more severe shoulder separations, these ligaments, called the CC ligaments or corticoclavicular ligaments, are injured, and when those injuries occur, the collarbone tends to be much more elevated in relation to the edge of the shoulder blade. As a result, athletes will oftentimes notice a prominence of their collarbone end in relation to their shoulder blade, and that may be quite visible to the naked eye. The treatment for shoulder separations depends upon the severity of the injury. More mild injuries, where the ligaments are simply just stretched, are typically treated with rest and activity modification, and usually over a few weeks' time the athlete is able to return fully to sport. In more severe shoulder separations, where the ligaments are completely torn or disrupted, the collarbone may be significantly elevated in relation to the shoulder blade and thus have significant increased mobility, which can produce pain with use of the arm or shoulder. If that is the case, the shoulder may be stabilized with surgery, where the ligaments that hold the collarbone and shoulder blade in a proper relationship to each other are repaired to allow the collarbone and shoulder blade to sit in their normal relationship. This allows for these ligaments to heal in the proper tension and allows the shoulder blade and shoulder to function normally with overhead sport activity.